Surreal, monumental, like nothing we've ever encountered. A nightmare becoming reality. These are just a few ways the COVID-19 pandemic has been described.
This is what it is. This is coming home after a COVID-19 shift. It's coming home to a sink full of dirty dishes that we haven't had any time to do, that we've been so stressed. More garbage that needs to get taken out. It's just overall the apartment being a mess because we've both been working.
Mondays we do school with Dad, and school consists of art. We'll sit down, draw some pictures, color. Recess consists of playing basketball. I don't want her to have to worry about anything.
Hopefully this helps understand that the more people stay at home, the safer they are and the safer we are to get out of our job and get home to our loved ones at the end of the shift safely and clean and not contaminated.
We have not been able to see Thomas face to face for more than 3 weeks now. It's very much an altered routine, which many families who have individuals, loved ones with disabilities have learned to adjust to.
Recently, I had 3 years sober, but I drank again about 3 weeks ago. So we're just getting back into the rooms and reconnecting with people. Everyone's quarantined. I've been trying to take care of myself, so.
Where do you usually look for the main idea of an article?
The beginning paragraph and the end.
Perfect. It's really, really hard to know whether they're understanding something when you can't see their faces, you can't see their eyes, hear their expressions.
I miss seeing my teachers and I miss interacting when I learn. But I mean, if it'll help people stay alive, then I of course want this to be the way it is. I wish it could be different. I really do.
I was on a webinar with the CDC where they were talking about reusing PPE, like how to sterilize your masks and your gowns and make supplies last. And that was one of those Twilight Zone moments that made me feel like this is some kind of nightmare becoming a new norm. But then at the same time, the fact that I even have one is a blessing. The fact that it's from Home Depot and doesn't really fit me it's like the best we can do with what we have.
What I don't have control of are the unknowns, what's yet to come. And quite truthfully, I think we're pretty far away from what's yet to come. Nobody knew of this until a couple months ago. By then it was already too late to try and prepare for it.
The coronavirus is affecting each and every one of us. School buildings are empty. Events have been canceled. Lives have been lost. Connecting with family and friends is difficult. That's why we've been collecting your stories, because from frontline workers to high school seniors, everyone has a story to tell.
Today, healthcare is about empowering people to take control of their health. Whether creating a fitness routine, choosing the right procedures and medications, or adhering to treatment for a chronic condition. Capital Blue Cross, dedicated to underwriting transforming health for the good health of the community. WellSpan Health, helping patients reach their health goals through a coordinated system of physicians, hospitals, and convenient healthcare services in communities across central Pennsylvania. Learn more at wellspan.org. WellSpan Health, for the journey that is life. Support also comes from viewers like you. Thank you.
Hello and welcome to Transforming Health, the Coronavirus Diaries. I'm Kira McGuire. In these strange times, even this show looks a little different as it has been produced remotely. Over the next hour, we'll take time to share our collection of coronavirus diaries with you. We hope that these stories will give us a sense of connection during this time of separation. In March, the first cases of COVID-19 in Pennsylvania were confirmed. And less than a month later, on April 1st, Governor Tom Wolf issued a statewide stay-at-home order to slow the spread of COVID-19. But those on the front lines of the pandemic have not had that luxury. Every day, EMTs, nurses, doctors leave the safety of their homes in order to help others.
Hi, it's Tuesday afternoon. Normally today I'd be staying late. Would have been our board of directors meeting. We meet every month, and due to the COVID-19 situation, we've curtailed any unnecessary meetings, so I'll get out of work here just a little bit earlier tonight. My cube is starting to look more like a stockpile of sorts. We've got some extra supplies that are getting stored in my office.
Chief Stevens, tell me about the calls you're getting right now.
In general, the feeling is people are just afraid to go to the hospital. So the call volume has dropped off. Those people who sometimes use EMS as a taxi cab to get to the hospital have stopped calling. But the patients we are seeing seem to be more sick.
We'll be your tour guides today for the decon of this lovely vehicle that will be our chariot for the day. Wipe down all surfaces that potentially could hold any spores, which pretty much is everywhere. So we do walls, we do benches, we do cabinets. We do it all. One-stop shop for cleaning.
They're hands-on, they're wiping down things, and that's good, but we want to be better than good.
Following the morning ritual, deconning inside, getting the trucks cleaned outside. Busy day outside the ER at York Hospital. Trucks are lined up, and the tents for evaluations of patients coming in with COVID-19 symptoms. The saga continues.
As far as patient care, it's a little more difficult. It's a lot more suspicious. Dispatchers now with the COVID-19 are looking for priority symptoms. So a fever, with a dry cough, those type of things. Anybody with priority symptoms, now they're using the N95 mask that we've heard a lot about. Right now, all of our personnel are issued an N95 mask. They're told to hold on to that mask unless it becomes physically damaged, that it's not usable, or obviously soiled. That's the only choice we have. Beyond that, if we were switching out with every patient, we'd probably make it the next 30 days. That's be about it.
The outside pre-screening area at Wellspan York. All patients presenting with symptoms of COVID-19 go through a pre-screening before they're taken inside into the main emergency room.
We don't believe at this point any of our members have had contact or exposure to a COVID-19 patient. We're always waiting to find out if there's somebody that we saw, a week or 2 weeks ago that comes back test positive.
We come in, we have to take our vital signs to make sure we are fit for duty and not having any cough or any symptoms of the corona or COVID-19. And then once we're done that, we will proceed to decon the entire truck, even though the overnight crew probably did it as well. But better safe than sorry.
We're always concerned, and that's what makes the job of the EMS provider so much more difficult. There's a lot of unknowns. That's always in the back of your head that at some point you're going to get sick or you're going to be exposed to something that you don't want to.
Hopefully this helps understand that the more people stay at home, the safer they are and the safer we are to get out of our job and get home to our loved ones at the end of the shift safely and clean and not contaminated.
When we start talking about essential personnel, we're the epitome of essential. We can't shut down.
So if you could deliver a message to the general public, what would that be?
The biggest thing that you can do is nothing. Stay at home. Don't venture out. As uncomfortable as that is, that's what's going to help slow this process down. We're trying to stop that surge. It's that surge that will overwhelm the medical community.
It's Sunday, March 29th, a little bit before midnight. I just made myself some tea. Figured I would start my video journal for you now because I'm finding it increasingly hard to sleep at night. Thinking about getting back to work tomorrow and every day last week was so surreal, like every day was just a new nightmare becoming a new baseline reality. My professional life for the past 10 years has revolved around caring for the terminally ill and the actively dying. There are days when I come home crying and things that I need to decompress, but it's usually not such a sustained, prolonged, anxious anticipation of what's to come. And that's what makes this different, is the not knowing what's going to happen.
So, Susie, tell me, how are you holding up with all of the changes at work?
Last Monday was the day I had an absolute breakdown because I got to work and saw how much preparation we were doing for something we knew was coming, and yet at the same time just feeling vastly unprepared. And it's like I said, every day last week was like a new level of nightmare becoming a new norm that was just hard to digest. Like, where I really pinned it coming from was this feeling of being so unsafe and, in a sense, abandoned. Hi, good morning. It's Monday, March 30th. I'm headed into work. I had actually submitted my resignation earlier in February with a anticipated end date of April 10th. That's been derailed pretty aggressively. We'll figure out, whatever the next few weeks brings. Hi, it's me again. Home from work. This is Professor Theodore Pawfield, one of my quarantine buddies, and the naughty Miss Eloise. Yeah, I know, you're sweet. You're not naughty. You're sweet. I know, you're my good girl. So I was up on these isolation wards that were really intimidating over the past week because I would see like the plastic with the zippers and signage and thought like, I'm not going to go in there until I absolutely have to. And today was the day that I had to. Going forward, my responsibility to my community will be managing the inpatient dying population. And that's going to be increasingly more and more COVID patients, as there's several nursing homes in the area that are starting to report outbreaks. I was given an N95 mask, although It's, as you can see, a contractor version, because we just don't have the medical ones that are adjustable and have been fit tested to our faces. And then this face shield that goes on like this, and after every patient encounter, we sanitize the outside with bleach wipes, and that in theory protects the outside of this from getting droplets on it, but as you can see, it's not a perfect system, and it's it's not a reflection of my own organization, which is doing the absolute best they can, or even my community, which has stepped up and donated as much as they can to our supplies. It's unfortunately just an impact of this whole outbreak that our system was not prepared for. Inevitably, I'm gonna be exposed. Could have been today. Even though I'm lucky in that I don't have to worry about coming home to a family and exposing young kids or older parents, or even a spouse at this point in my life, it can be really lonely too. I have some family that lives close to me, and knowing that I'm not gonna have that human interaction with them for weeks really weighs on me. There's just something that, hugs and kisses with the babies that you love in your life, that FaceTime can't replace. And even knowing that even after the last patient I treat, I still have like a 2-week period of needing to self-isolate from them is hard. But my journey is certainly no harder than someone else's, because we're all having to make incredible sacrifices. It's a real thing. I'm gonna put my feet up and maybe paint my nails and do some aromatherapy, a face mask, make dinner.
Nobody knew of this until a couple months ago, and by then it was already too late to try and prepare for it. Good evening, it's Sunday. It's the end of week 2 of social distancing, and now a stay-at-home order by Governor Wolf. The weekend's been kind of short. It's gone fast. I haven't physically been at work, but with that said, I've spent a great deal of time texting and emailing and video conferencing, all geared towards infectious disease, COVID-19. I wanted to share, just a little bit of my frustrations over the weekend. We now have an extended care facility in our primary response area that is on quarantine, but they didn't share that information. So our crews showed up there for a call, and once they were inside the facility, they were told about the quarantine. It's prompted me to enforce a N95 mask usage on all patients at all extended care facilities. But with that comes some challenges, some concerns. The N95 masks are on back order for us. They still haven't come in. But as we increase usage and this becomes a longer event, that stockpile dwindles away. With that said, one of my paramedics and all well-intentioned question, shouldn't we be in better PPE? Shouldn't we have full face shields all the time, mask all the time with every patient encounter? And at this point, I'd like to say yes. Hands down, yes. We should be in an upgraded mode. But the reality of the situation is the stock isn't there. So it's frustrating to me. It's a horrible challenge to try and balance that out. And quite truthfully, I think we're pretty far away from what's yet to come. I'm concerned. Our folks that work for us here are concerned. and rightfully so. And we just keep pleading with the public to, just follow the rules, just stay at home, shut yourself away from everyone else. So try and relax a little bit this evening and get myself ready for week 3, and we'll see where that takes us.
Hi, my name is Martha. I'm a registered nurse here at Hershey Medical Center, and I am a member of the Special Pathogens Unit, and I am currently been deployed to help take care of patients during the pandemic.
Martha, I understand you volunteered to work on this unit. Why?
I volunteered in that because I'm a little bit older than my peers. I'm 61, and I remember when AIDS and HIV came out, and that was a really difficult time for a lot of people. And one of the things that made it so difficult is we didn't know anything about it. And as they know me to say that fear is the mind killer and education is the cure. So let's find out about it. So I said we need to be involved.
Well, thank you for doing what you're doing. So you've now been treating patients that are COVID-19 positive for about 6 weeks. What have you learned about the virus?
This does not act like anything else that we've ever encountered. I've been a nurse for about 20 years. I've been with Hershey Medical Center for 18. I don't think we've ever seen anything like that, like this, that's moved so quickly, that has really demanded that we be thinking on our feet and trying to adapt to all the changes and things that we've learned along the way. I don't think anybody has, and I think that's what's taking everybody by surprise. We are developing evidence-based practice right now, so everything that we're doing now, it will impact what we do in the fall, because we anticipate this coming back, and we anticipate having to deal with this probably for the rest of our lives. So we're right in the middle of an experiment.
Hi, now we're here at the COVID unit here on the first floor of the Hershey Medical Center's emergency room. We have 12 beds. You can see them here.
The flow of patients, it waxes and wanes. Some days we have all 12 beds are full up, but it can change in a heartbeat. It truly can. So we have to be ready.
This is our cart that we keep all of our stuff in, all of our supplies. It's got gowns and gloves and more in it. And these are 2 of my co-workers here. This is Clarissa and this is Vianney. They're showing the new gowns the gown outfits that we have to wear. This is one with the N95 mask, and this is called a PAPR unit. So you get the unit, you get to wear the respiratory system that's appropriate for whatever task that you're doing.
We've been training, like I said, for the past 5 years, wearing this PPE, and it's a multiple layers of protection. And I'm used to it. We've been doing it. We've been practicing for this. And I think you have to be careful that you don't get too lax. So we watch each other, we encourage each other to make sure that you're putting the layers on properly, and more importantly, you're taking the layers off properly. I just shift my brain into patient care and focus on that, and just try to ignore any of the other discomforts that might come along. We have young adults all the way to very elderly that have been positive or that are concerning for it. Some people are very ill with high fevers on our unit. We've had a lot of respiratory discomfort and increased oxygen needs, and that's a little frightening for people. I can't breathe. So a lot of reassuring. Using our audio system to call in, assure them that I'm watching you, it's okay. We're able to watch the monitors and say, don't worry, I'm watching you. A lot of reassuring going on. With COVID-19, because it's so contagious, we go in, we try to reduce the number of times that we go in, because that trip, not only is it exposing me to it, you to me, but also every time I go in, I have to use a whole set of PPE. So trying to also be diligent with our supplies, trying to make every time I open that plastic, take everything out of their wrapper, that it counts. We group care around meal times. So I bring in your breakfast or your lunch or your dinner. I bring your medications that are due at that time, do vital signs. I'm in there for about anywhere from 30 minutes to some people, because they can't feed themselves, I'm in there for over an hour, and then I leave. And then you're by yourself for the next 3 to 4 hours until I come back in and start the process. It's a much, much different hospital experience. So it's a little frustrating for nursing, because it's not the kind of nursing that we've been doing, and it's not the kind of nursing that we want to do. We want to be able to spend extended periods of time with our patients. But but this is the best way that we can do it right now.
Martha, you mentioned that you have asthma. You're 61. You are in this higher risk category. So why do this work?
I would be considered a risk patient, but I believe in the process. If I'm using my PPE, if we're following the protocols that we're supposed to be doing, then I feel very, very confident about it. I love my job. So it's not going to work for me. And to be with people, to educate people, to do the scientific stuff, to advocate for better patient outcomes, what an awesome job I have.
You'll remember before the COVID-19 pandemic, one of our main public health concerns was the opioid epidemic. And although the headlines have changed, the opioid epidemic persists, and those in recovery have had to face new challenges during this time.
My name's Danny Albert. I'm a person in long-term recovery, and what that means for me is I haven't had a drink or a drug since April 30th, 2017.
Why are you concerned about those in recovery?
Yeah, I think relapse is always possible, especially at a heightened time where, there's a lot of insecurities and a lot of things that are out of our control. It's easy to focus on all of the negatives.
What about those on medicated assisted treatment?
When it comes to medication, Suboxone and buprenorphine, I know that from what I've been hearing is lines are long. So people are actually getting frustrated with the fact that they have to wait so long for their medicated assisted treatment. That worries me. So this morning, what I did with this pandemic and my routine has been with COVID-19 is I've been trying to have more structure to my day. So I wake up, first thing I do, open my eyes, thank God for another day, and I start to meditate. I'm just really mindful and present of the moment. At noon, I have a Zoom meeting with the 12-Step Fellowship. What I'm trying to do is, what helps me is staying connected. One thing that's been a struggle is the fact that we don't go to meetings and we can't see people one-on-one, and this way we can visually see other individuals in recovery on the same mission as us, as myself, just trying to get another day of recovery. A lot of my friends, we call and check in on each other, and we just see how we're doing. It's kind of the silver lining of this whole entire pandemic, is knowing that even though we're apart, we're never alone. One thing that Hero in the Fight is doing, we have alcohol-free hygiene items we've been putting in bags. So that way we can kind of help out a little bit with people that need those items. Anything we can do to help, paying it forward, giving back, and being there for one another, to let people know they're not alone. Especially at a time like this. Another blessing that I have is on Sundays and Mondays I get my daughter. So she'll stay overnight, and Mondays we do school with Dad, and school consists of art. We'll sit down, draw some pictures, color. Recess consists of playing basketball. What I'm trying to do is remain positive in light of everything, and I don't want her to have to worry about anything. So when I focus on enjoying my time with her, it takes me away from everything that's going on. Kev, 6 years in recovery.
This COVID-19 has definitely thrown a wrench into all of our lives. I can feel that the lack of connection. I'm a guy that goes to at least 4 meetings a week. Please check people you know that's been in recovery that might be out there struggling, people, especially people new into this. You know, this has got to be very difficult for them. I would not want to be going through the beginning of this. And, you know, we all need to stay connected. A kind word, kind phone call, just to check up makes you feel better. God bless everybody. Keep your recovery. It's the greatest thing that ever happened to me.
So I'm sitting outside. It's beautiful out. Birds are chirping. Yesterday it was raining and kind of miserable. But it's like that. There's some days that are like that. It's kind of like the time we're in right now. You know, there's a lot going on with COVID-19, but there's good days ahead. That's the way you have to look at it.
Good morning. I am person in long-term recovery. I am here starting my morning. My son's joining us. He's got Spider-Man. My daughter's still sleeping. This is certainly a morning in the life of somebody in recovery. The first couple weeks of the, self-quarantine were difficult. I think that as we're continuing to have to be inside as people in recovery, we're becoming very resourceful and just being more honest about asking for help. And I'm trying to work full-time, maintain my recovery, maintain my sanity, be a mother, homeschool my kids, get their work done so they don't fall behind. And just kind of manage through the day. I started doing a daily meditation for some of the other healthcare professionals like myself that are fighting, continuing to fight the substance abuse epidemic, but also, fighting to maintain our sobriety and our sanity in this tough time. I have a couple of my girls in my women's support group that we have like a group text. We're using this app called Marco Polo, where we can send each other video messages. So really, I'm just trying to connect to every outlet I possibly can to stay connected. And so something I've been, really thinking about today is to continue to do everything in love, and most importantly, right now, love myself. To not have high expectations on myself that, if we go to bed and there's some dishes in the sink, it's okay. We had a long day. We're trying the best we can. We are fresh off of a typical quarantine meltdown situation. Chloe's brother broke her doll bed. Luckily, we have our family supports in place, so nothing that a FaceTime from Grampy can't fix, right, Chloe? So Chloe actually was about 3 months old when I first went to treatment, and where Chloe doesn't keep me sober or clean, she was definitely the movement for it. Chloe, what are you doing to stay calm during the quarantine?
Color and do crafts.
We've been doing a lot of crafts. But yeah, so there we are. It's a little insight into our day. We're trying to not have any more meltdowns today. So here I am with my last vlog.
And I said we're in bed.
We're in bed, as my son says. It's been a full day of...
and I saw a bug.
He saw a bug.
And a skunk.
This is a day in the life.
And I also
okay.
a skunk.
Today was a rough day. A lot of meltdowns, a lot of struggles. I was very powerless many times today. But I reached out and I got support, and I made it another day. One day at a time. Very one day at a time these days. I say a prayer and I go to bed. And I wake up and hopefully, I do it all again tomorrow. I think it's a great idea that we keep doing these so we can look back and maybe we can look back after the pandemic's over and coronavirus is gone and really be able to see our resiliency and our strength, because that's what I'm seeing now, resiliency and strength. So I think that when it's all over, I think we're going to come back stronger than ever as a recovery community, stronger than ever as people working in the field with substance use disorder and mental health. And I think that we're going to come out of this with a lot less stigma associated to mental health, because other people are realizing that they are out of control too. They're also powerless. How do they control it? So I'm ending my night here like I usually do with my son, who doesn't want to sleep in his own bed. We just meet him where he's at.
On March 17th, Governor Tom Wolf implemented a no-visitor policy at nursing homes. Mitigation efforts also included a recommendation for restricted visitor policies at state centers and group homes for people with disabilities, forcing many to spend their days inside and without normal visits from loved ones.
My name is Dennis Downey. I'm a retired professor of history, and one of our children, Thomas, has multiple disabilities and lives in a group home just 5 minutes from us.
So, Dennis, tell me about your son, Thomas.
Well, Thomas is 29 years old. He is the fourth of 5 children in our family, and he has multiple diagnoses of cerebral palsy and intellectual disability and autism. Thomas has a wonderful personality, great sense of humor.
And how has the coronavirus affected your ability to see your son in person?
We have not been able to see Thomas face to face for more than 3 weeks now. But we do FaceTime him every day. We call every night. It's very much an altered routine, which many families who have individuals, loved ones with disabilities have learned to adjust to.
And how are you holding up?
FaceTime has proven to be great, but it's a very poor substitute for the human connection and the presence of another person. Just this morning, on the way back from a doctor's errand, I drove by his house, and there's always a bit of a degree of longing because you can't stop. You can't stop and just say hello. Well, it's about 11 o'clock on a Sunday morning, and been up for a good while. And today is anything but routine for us. Normally on a Sunday, we would be getting ready to go to church. We'd come back, have a little quiet time, and then our son Thomas would be coming to spend the rest of the day in the evening with us. But because of the virus, that's not possible.
What would a typical day look like for Thomas under normal circumstances?
He has a day work schedule, and he has someone who accompanies him as he goes out to various settings in the community to do volunteer work. Hospital, at our church. And so he would have a fairly full day. And that would include going for a walk in the afternoon in the neighborhood and being outside and being in the community more. That's now all restricted. He's just not able to do that. And so for him, his whole daily routine is pretty much spent at his house. We've yet to even begin to imagine the kind of mental health toll that all of this will take on everyone, and particularly people with various disabilities.
I'm Tracy, and my husband Dennis and I are here at our son Thomas's house. We got a little bit of a care package put together. Could not find hand sanitizer, but we have some Aquaphor hand cream, we have Sheetz gift cards, we have some sweet treats, we have Thomas's favorite Rice Krispie treats, and something for his housemate as well, some brownies. So we're just trying to let them know, the staff especially, how much we appreciate what they're doing. They really are on the front lines here and taking care of people, and we just want to let them know how much we appreciate them and let Thomas know how much we love him.
He's receiving good support, and we remain in very close contact, whether it's telephone, email, or FaceTime. And we've done Zoom meetings with the staff and things like that. But I think at Thomas's house, they're doing a good job with cleanliness and wearing gloves and a mask. And, you know, a large measure of all of this is trust. And you just have to trust that people are following through and doing what's appropriate.
So I made a sign for the house where Thomas lives, had to improvise quite a lot like we all are doing, adapting, trying to adapt these days. So this is for the folks who work with Thomas and his housemate. They are really heroes, and we thank them.
This is Thomas. We're FaceTiming here in the afternoon on a Sunday. Normally he would be with us, but not able to be with us today. Well, you look great in your beard. That's something new, isn't it? Yeah.
What will that day be like when you can physically be reunited with Thomas?
Resuming normal family life will be a gift, and I don't think we'll take it for granted. And I know that Thomas won't, but it's all part of what it means to be a family, to be together.
On March 16th, school buildings in Pennsylvania closed over fears about the spread of COVID-19. At the time, teachers and students didn't know how long they'd be away from each other. They were forced to create a new way to connect and learn.
Hi, my name is Olivia. I'm 18 and I'm a senior.
Olivia, how long has it been since you were physically in school?
It's been about 22 days since I've been at school.
And how are you doing?
I've never gone through anything like this, so it's definitely, I think, the scariest thing I've ever gone through. I don't know what's going to happen. I think throughout my life, I've always had adults that could tell me what was going to happen, and nobody really knows. Having everything be canceled now is it's kind of heartbreaking, I have to say.
And right now I'm doing a soil lab for my AP environmental class, and I'm about to log on to an English meet. So I'm right in the middle of my day pretty much, and it's a lot more chaotic than I thought it would be. There's a lot more work to do. I have a pretty long list of things to get going.
And I miss seeing my teachers, and I miss like interacting when I learn, because that's how I learn. The online schooling isn't necessarily, you know, my favorite thing to do. It's just not the same thing, and I think that's worrisome for me, but I mean, if it'll help people stay alive, then I of course want this to be the way it is.
So I just got my graduation announcements. They're really cute, but we had to take off like the information about the party and things like that. And it's basically just me saying that I'm going to Bloomsburg University and that I am in the honors college and I'm gonna major in political science. The graduation announcement was actually a really good pick-me-up, because I'm graduating high school, and that's a really big deal. And I think even though, you know, it's in a pandemic, it's still like one of my dreams. And I think that from this I've learned that if I can take away anything, it's just to keep going by each day and keep hoping for a better day than the last, because I think that's really all I can do right now. So I just found out that I will not be going back to school ever again. I kind of expected this to happen, but it's definitely not what I wanted. I really wanted to have like a last day and a last performance with my friends that I've been playing music with forever, and I wanted to, you know, get to say goodbye to my teachers and have that kind of last day thing. And my friends and I always take a picture of all of us on the last day of school, and now we won't have one of those either. And it just kind of feels, it doesn't really feel real that any of this is like actually happening, but I know that it is, and I never will be a student again going into that building. And that really just, for me personally, this was like one of the things I was really, really afraid of, and I'm mostly at a loss for words right now. I wish it could be different. I really do.
How will you get through this situation?
I think just recognizing that it's okay to be upset about things that we're missing, because I feel part of me feels kind of guilty for feeling sad about this stuff, because I don't have bad health, and I haven't been personally affected by the virus, like physically or anything, but I think just accepting that it's okay to be upset that these things are happening and things are not working out the way anyone really wanted them to.
How do you think you and others your age will remember this time?
Well, I think that it'll be like a unifying thing that everyone my age has gone through, because I'm 18, so I wasn't alive during 9/11, but I know that was a very unifying experience for the country and for the world. And I don't think I've ever lived through something quite like that before. So I think it'll be like kind of how we define our generation.
Hi, I'm Tammy Novick, and I teach 4th grade at Green Ridge Elementary for Cumberland Valley School District, and I've been teaching for 30 years.
Tammy, how is it going teaching online?
I have to say, in my 30 years of teaching, I never thought I would go to remote learning.
All right, so I'm going to share my screen. Can everyone see the whiteboard that's up?
It's more difficult because I really feel the boundaries are blurred, especially when we first started. It's getting better now. For the first, I'd say at least 2 to 3 weeks, I felt like I was basically on call all the time because I was trying to check my email even in the evenings, because a lot of times that's when the kids could do their work.
What does your new teaching schedule look like?
3 days a week for an hour. I'm online with the kids explaining the lessons. And the other 2 days a week, we have what's called morning meetings. And I get online, and all 27 of my kids are usually online with me.
Good morning. It's about 5 minutes of 10, and I start my what we call our morning meetings, which is a time for us to check in with our kids. So I'm about to start my Zoom meeting with them, and I usually start about 5 minutes early because the kids are waiting to get in. Hi, good morning. How was your weekend? Good. So you know how we used to toss the stuffed animal, and we'd toss it to someone in the class and they'd catch it and we'd say good morning to them? Well, that's what we're gonna do today, except that we're gonna pretend that we're actually tossing it to them. I'll start, and I will say, I'll say, good morning, Pierce.
For the most part, the kids have been great. They love morning meetings. There's been moments when I feel like I can't reach out and really help them. It's really, really hard to know whether they're understanding something when you can't see their faces, you can't see their eyes, hear their expressions, especially for those kiddos who struggle. It's really hard because normally where I would sit beside them and talk to them quietly so that it's just one-on-one and it's more individual, so then they're not embarrassed that they didn't understand it or had difficulty with it. You can't really do that online.
Where do you usually look for the main idea of an article?
The beginning and end. The beginning paragraph and the end.
Perfect. First of all, do you think the main idea is in the first paragraph?
Yeah.
Yes, it is.
What do you think your students will learn from this experience?
I really feel like I'm still able to teach them the most important things, which are the big life lessons. I really think that this experience has allowed us to show the kids and to show them that we don't know what's going to happen. We can't control our surroundings, we can't control our situation, but that we can control how we react to it, and that we need to make the best of every situation and stay positive and embrace the changes and give it our best.
We have all been impacted by the coronavirus pandemic, some more deeply than others. And although it continues to separate us in many ways, we now all have a shared experience.
We are, as a whole nation, learning all together. So I think that's going to be a huge takeaway, that we look back and say, this was a monumental event. I made it through one of the worst pandemics we've had in decades, and I was part of that solution. The treatments and the procedures and the guidelines that we have now, I was a part of that. And we are making history right now.
It also reminds us that we're all somewhat vulnerable. And that's a lesson to be taken from all of this, and not taken lightly. That we all have our special needs, and we are here to help each other in achieving those needs.
If we all just kind of stay positive, look at what we can do to help others, and remember that we will get through it and life will return to maybe not the same normal, but some semblance of normal at some point.
Once we get past this, and we will, maybe not take those little things for granted as much anymore. I think the introspection is significant. We learn about ourselves. We learn more about the people that are around us. Hopefully we just become better people across the board, a kinder, gentler nation.
And once the true crisis of this situation is over, I think that all of us, regardless of what our professions are, have a responsibility to think about what can we do to prevent things like this from ever happening again. How much of our world or how much of our lives are things that we genuinely need? How much were we okay going without? How do we live more modestly and more mindfully and be more conscientious of each other?
We're all fighting this battle together. And just like when people fight a battle together and they get through and they come out on the other side, they gain these like beautiful relationships with people because they were all part of that struggle. And so I think that's what it's going to be for us. We're going to have a greater understanding of how much we mean to each other.
If anything comes out of this, it might be more empathy and more sympathy for one another. Even if it's just for a little while, I think that we can recognize that we've all lost things, whether it's people or, things we've looked forward to for a good part of our lives. I think that it's still something that we can recognize within each other that we've lost.
As a person in recovery, the way I see it for me is, I know what it's like to have lost everything. I know what it's like to sit in a treatment facility for 30, 60, 90 days in a building, not being allowed to leave. So it's going back to those kind of mentalities that I had. I've been here before. I know I can get through anything. And at the end of the day, I'm going to come out stronger, just like all of us.
I'd like to thank all of our video diary participants for sharing so intimately the ways in which they've been impacted by the virus. We hope that these stories have provided you with a feeling of connection during this time. Please join us next time as we continue to share stories and transform health. I'm Kira McGuire. Thanks for watching.
Today, healthcare is about empowering people to take control of their health. Whether creating a fitness routine, choosing the right procedures and medications, or adhering to treatment for a chronic condition. Capital Blue Cross, dedicated to underwriting transforming health for the good health of the community. WellSpan Health, helping patients reach their health goals through a coordinated system of physicians, hospitals, and convenient healthcare services in communities across central Pennsylvania. Learn more at wellspan.org. WellSpan Health, for the journey that is life. Support also comes from viewers like you. Thank you.